Hi everyone, thank you so much for joining us today. You are listening to the Migrant Health series of the Reimagining Global Health podcast. This podcast is presented by the Reimagining Global Health group at McGill University, and it is a collective of students and faculty from all different backgrounds who organize a variety of events and projects like this podcast to expose and challenge the colonial oppressive dynamics that infiltrate the equitable goals of global health. In this series on migrant health, we have 3 interviews with 3 different guests that will shed some light on the issues surrounding migrant health from very different perspectives. The series is in collaboration with CIM, the Collaboration Interprofessionnelle Montréalaise Étudiante, a non-profit McGill University organization composed of interdisciplinary health science students that provide a hands-on public health learning opportunity with the goal of promoting improved healthcare access for asylum seekers in Montreal. This podcast series on migrant health is also in collaboration with IFMSA Quebec Scorp and McGill, the Standing Committee on Human Rights and Peace of the International Federation of Medical Students Associations, and they strive to create an equal and peaceful world and believe in international, intercultural, as well as interpersonal solidarity. Our first episode will explore the experience of Amar Forkou, a first-year medical student at Université de Montréal, who is also a Syrian refugee who arrived in Canada in 2016. In that episode, we will discuss his journey from migrant to medical learner and his personal experiences in the healthcare system. Our interviewees for the second episode will be Daria and Kenzie Abdelhamid, co-presidents of MedCom. MedCom is a collective breaking down linguistic and cultural barriers by engaging in research, advocacy, and the development of a mobile app to connect patients with medical student translators. They will take us through the challenges of translation in a healthcare setting and the solution they are trying to build with their mobile platform and the very promising research and advocacies they're carrying out to incorporate linguistic sensitivity in current medical school curricula. Our final interview will be with Pénélope Boudreau, a nurse and director of operations of the Montreal branch of Doctors of the World. Doctors of the World is an independent international group who fight for universal access to healthcare. In Montreal, the organization has opened a medical clinic for migrants with precarious status who are not covered by public insurance and do not have the financial means to access healthcare services. During that insightful conversation, we will speak about barriers to care for migrants, the impact of these barriers on their health, and the work done by Doctors of the World to break down these barriers. So please subscribe or follow this podcast wherever you listen to podcasts to be notified when we release our first episode, which should be around April 23rd. Follow Reimagining Global Health, CIM, and IFMSA Scorp on all social media platforms to stay up to date with our events and our future work. We'll have them linked in the show notes. Thank you so much for listening, and please stay tuned for the first episode of the Migrant Health series of the Reimagining Global Health podcast.